have forehead lines that you can't cover up anymore and it's bothering you? I get this question often when patients come to see me in clinic, so I wanted to share with you possible solutions with its pros and cons if it's a concern for you. Before that, let's quickly go through what's causing these lines in the first place. It will help make better sense when I go through the solutions. For any line on the face, it can be a dynamic wrinkle or a static wrinkle. A dynamic wrinkle is a line that occurs after moving a specific muscle. So for example, if you're moving your eyebrows and scrunching your forehead, and a line appears after relaxing those muscles, that is a dynamic wrinkle. Dynamic wrinkle goes away if you don't move your muscles that much. A static wrinkle is a line that's present at rest whether you move your muscles or not. A dynamic wrinkle is caused by the muscle repetitively creasing the skin that's lost its elasticity, creating an edge on the skin. More typical in the younger age group. For the static wrinkle, this is caused by loss of volume or collagen alongside repetitive creasing of the skin. Static wrinkles usually follows a dynamic wrinkle if it's not treated, so it's like a permanent fold in your skin. So what can we do? First, we strengthen our skin by improving the elasticity and collagen production. We do this through anti-inflammatory skincare, anti-inflammatory foods, and anti-inflammatory lifestyle. We want our body to be more rest and repair versus wear and tear. The process is simple, affordable, and you're working internally for long-term health benefits. However, it can take some time to work depending on your current lifestyle and how deep your lines are, so it depends on how committed you are and how much patience you have. You can also strengthen your skin through skin treatments like home derma rollers, in-clinic microneedling, or skin boosters with mesotherapy, hyaluronic acid, or platelet-rich plasma (PRP). It's a deeper treatment so you can see results a little quicker. However, there is more recovery time and it can be expensive depending on where and who you go to. Next, we want to train our forehead muscles so it doesn't scrunch up the whole of our forehead. This is from the muscle frontalis, which runs from the eyebrows all the way to the scalp. You can do this naturally with facial exercise or with Botox. The aim is to isolate and activate the muscle fibers that lift the eyebrow, but relax the rest of the muscles so it doesn't create those horizontal lines. And here's a demonstration of a facial exercise to reduce forehead lines. So you want to lift your skin over your forehead. Lift your skin over your forehead. Then try to lift your eyebrows. Your forehead muscles will ache a little. Do this about 10 times. Then take your hand out away and try to lift your eyebrows. It's going to be a little bit more tricky. Try it. Let me know how it feels in the comment section below. Of course, compared to Botox, this is natural, but the cons is it may or may not work depending on your muscle anatomy, and it takes time and commitment. Next set of treatments which I'll go through are aesthetic treatments to treat forehead lines, which has its benefits but also higher risk of side effects and complications. So you want to make sure you choose your practitioner well and get all the information you can before proceeding with the treatment. First one is Botox, which is better mainly for dynamic lines, not so much for static lines. Botox helps to relax the muscles, and depending on where you put your injection, it can even lift your eyebrows up. It relaxes your muscles, so when you move your muscles, it doesn't crease as much. It's a good way to prevent the lines from getting worse, and then you can focus on good skincare to improve the line edge on the skin. Results takes up to 2 weeks to work and can last between 3 to 4 months. If you have too much Botox, it can paralyze the forehead muscles, creating a very tight sensation, giving a very plastic look, or it can cause your eyebrows to droop. Hence why it's important, if you do decide to have Botox, to have baby Botox, which is very small amounts, just to soften the lines and not affect your movement too much. So as you can see at the moment, I have Botox in my forehead, and this is what I do for my patients, baby Botox. Next is Dermal Filler, which is better for static lines. Dermal Filler is made of hyaluronic acid, which is the substance you have in your skin, your joints, and your eyeballs. It helps to replace the volume that it's lost, and it can hold 1,000 times its weight in water. A good way to check if you're suitable for dermal filler is actually to stretch the lines and see how much it's reduced. Dermal filler is a quick way to replace volume and lift the folds in your skin. However, it can be expensive and there's a higher risk of bruising, infection, and swelling. I want to make a special mention to laser treatments and radiofrequency. I will personally and professionally not recommend it for forehead lines. Laser treatment may seem to work at first, but there's a higher risk of burns, post-inflammatory hyperpigmentation, and thinning of the skin. Radiofrequency uses heat energy to shock the skin into producing more collagen and elastin. Problem is, radiofrequency can also break down fat cells, and although the forehead has less fat, there is still a potential risk of losing more volume. I personally use skincare, supplements, baby Botox, and home dermal roller to prevent my lines from forming. Which of these do you think you'll go for? Until next video, have a great day.